All right, so on to our first panel discussion. We'll make up a little bit of time here. I had a full 80s style jazzercise routine planned for the movement break, but we'll go ahead and cut that short based on Eloise's opening remarks. So our first panel discussion focuses on the question, how can we support active living for all to improve the health of West Virginians through systems and policy changes? Fortunately, the folks up here on the podium with me are much better qualified to answer that question than I am. Just a quick reminder of how this will be structured. We'll begin with remarks from Dr. Clay Marsh, who is the Chancellor and Executive Dean for WVU Health Sciences. Then we'll have a panel discussion with our panelists, our expert panelists, who I will introduce here shortly. And then there'll be those roundtable conversations where you all have the opportunity to engage relative to the topic and what you've heard from our panel members. Then on to the movement break. So Dr. Marsh, if you would get us going here, that would be much appreciated.
Okay, great. Who is my timer? Excellent, okay. So you're giving me 5 minutes and then to the end. Perfect. So good morning again. And what I'd like to do in the next 10 minutes or so is to try to help each one of you understand how you can live 20 years longer and better. So 10 minutes of your time, 20 years, maybe worth a shot. So we believe, and we're very proud of the fact that at West Virginia University, but also at Marshall University and in our other healthcare systems, we now have a network of healthcare that will allow everybody who has a problem to stay in the state. And we have experts in so many areas now. We're doing things first in the country, first in the world even, which is really it's a new day for West Virginia, I believe, in that way. But even though we're doing much better, I believe, in offering better health care, the health of our population is still one of the worst in the country. So I'm going to take you on a very quick dive into a bit of data. I'm going to talk about things that can help you live longer and better, and then I'm going to talk about the role of physical activity all within 10 minutes. So here we go. So what is health? A lot of people have tried to define it, but I think that a cancer journal recently answered it nicely because they said, why are so many young people getting cancer? And the answer they came up with is because even though they are chronologically young, their birthday age is young, their body's age is old. They are old even though they're young chronologically. So the health to me is where our biological age is as low as possible versus our chronological age. And if you don't buy that, then the rest of what I'm going to say is not going to be pertinent to you at all. If you buy that, then maybe I'll have a few interesting things to say. So there's a study in people in different areas of the world that live long and well called the Blue Zones, and we had a chance to work with the team, Dan Buettner and Ben Liedl and Dan's brother, and they explored these areas, and these 5 areas are Sardinia, Italy, Okinawa, Japan, Ikaria, Greece, the Nicoya coast of Costa Rica, and Loma Linda, California. And why Loma Linda, California? Seventh-day Adventists, that's right. So the key is it wasn't about what they did, although they came up with this Power 9 things that this group of people did different than others. It's about how they lived. They lived simply, but they lived well. Their life was happy. They weren't stressed out. They worked to live. They didn't live to work. And so if you transition that to the data in a number of other longevity studies like the Harvard Grant study or the longevity study that followed people for 8 decades or more, then they found there's 5 or 6 things that come out to be really, really important. The first one, what's the best thing that you can do to predictably live longer and better? It is the strength of your relationships. It is we need each other. If you look at the root word of health, It means whole, W-H-O-L-E, same root word as holy and holistic and heal. All mean whole. And so when we look at the impact of positive relationships in almost every longevity study, that's number one. And why is that? Maybe because in the evolutionary times, if we weren't with other people, what happened to us? We died. We got eaten. Exactly. And so being shunned from the group becomes really a problem. And remember, recently, Vivek Murthy, our Surgeon General, said the greatest epidemic we have right now is an epidemic of loneliness and social isolation. And in fact, how many years of lifespan will a life of feeling lonely and socially isolated cost you on average? Up to 15 years. Up to 15 years of lifespan. And there's even a number for the number of people you can know very well based on the biggest size of the group you could have survived with, and that's about 150 people, and that is called Dunbar's number. And so it really demonstrates that we are still being impacted by what happened to us during our evolutionary times. The other thing is how you look at the world becomes a really important predictor of your longevity. In a really interesting study in San Francisco looking at 58 women, all very high educated, socioeconomic, job-wise, they basically did a survey of the stress. 5 minutes, okay, I got to keep going. The stress that they felt, and the women that had the most feelings subjectively of chronic stress were compared to the group of women that had the lowest scores of chronic stress. And this was done by a Nobel Prize winner that won the Nobel Prize for telomeres, which are the end of our DNA. The longer they are, the younger you are, the shorter they are, the older you are, because every time a cell turns over, they get shorter. The lifespan difference between people who had the most perceptions of chronic stress and the least were how much? 17 years. 17 years, and these women were all average age about 38 years old. But the oldest people saw the world more threateningly. And so if we see the world as frightening and we see ourselves as victims, et cetera, then our lifespan is going to be shorter by up to 17 years, that study says. And when we look at the United States, we spend $4.3 trillion a year on healthcare, which is $12,500 per person, 1.5 times the next country, and twice as much as the average country. And our lifespan trails the best countries in the world, Monaco and Hong Kong, by 10 years. We have the worst outcomes of all westernized countries. And when we look at West Virginia, we trail the best state in longevity by 6.5 years, which is Hawaii. And our worst county, McDowell County, for longevity, trails the best county in the country, Summit County, Colorado, by 17 years of lifespan. 17 years of lifespan. So it is on us to help our state get healthier. And when we start to look at physical activity, if you are physically active, as little as 2,000 steps a day, you lower your risk of heart disease. If you get to about 9,000 steps a day, between 7 and 8,888, then you then start to maximize your protection from death of cardiovascular disease, but also of all-cause mortality. And you can get 2.8 to 8 additional years of lifespan. And so as we start to move, remember, when we were in evolutionary times, we had to move all the time. We weren't sedentary. We didn't have Netflix and a remote control, et cetera. So any activity is good activity. The other thing that I think is really important thinking about holistic health, there's a study in Spain looking at 3 to 6-year-olds, and they compared groups eating high levels of ultra-processed food versus children that didn't. And even by 6 years old, children eating highly or ultra-processed foods weighed more and had early signs of metabolic disease like diabetes at 3 to 6 years old. So we know that we are fixing the future of our life with how we behave. And this idea about find the child within you, I think, is more than just becoming happy, although that's super important, because the Blue Zone people saw life as an adventure, not like a prison sentence. And so for us, we should see the same. So I'm a critical care physician, and I've been with a lot of people when they've died. And everybody that I've ever been with who's been dying laments not being able to do what they used to be able to do, not being able to have another meal with their family, not to have a day outside with the breeze in their face and seeing the beautiful nature that we have in front of us every day. Our eyes are open, but we rarely see. We rarely see the beauty of what's right in front of us and appreciate the great privilege of our independence and our health. And I hope that you guys, as emissaries and missionaries and people that will go teach others, will help people see that we have an incredible state with incredible beauty and incredible people, and that includes each one of you in the room. The Sufi poet Rumi says, "You are not a drop from the ocean, you are the entire ocean in a drop." And namaste means the divine in me bows to the divine in you. Quantum physics tells us everything's connected. We're all part of a single bigger thing, like wavelets of the great ocean. And so if we take out of here the ability to treat ourselves well and then treat each other well, we then will go from healthcare to health, and we'll recognize the true potential of our beautiful state and beautiful people. Thank you so much.
Thank you, Dr. Marsh, for those opening remarks. I think you did a wonderful job of setting the tone about how important our conversations are this morning, so thank you for those. Joining Dr. Marsh on our panel this morning is Dr. Wanda Hembry, our Chief Medical Officer for Aetna Better Health of West Virginia, and we also have Joe Bozak with us, who is the founder and executive director for Game Changer, a program many of you are likely familiar with around the state. So my first question, as a follow-up to Dr. Marsh's remarks, I'm going to address to you, Dr. Hembry. So obviously, when we talk about health and healthcare and systems and policy, our healthcare system is an important part of that. How can healthcare providers and managed care organizations like Aetna Better Health of West Virginia encourage their members to lead more healthy and active lifestyles? And then what specific policies or programs could be implemented to encourage physical activity among patients?
I'll try. We look at this, the state of West Virginia is our customer, and we and the other managed care organizations contract with the state to help care for our most vulnerable population in West Virginia. We are able to communicate with the legislators every day on a daily basis via the West Virginia Association of Health Plans to ensure that we are abiding by our contracts to spend our taxpayer dollars wisely, your taxpayer dollars wisely, to maximize the health of all of our members. First, we start with our kids. I think that's where we need to start, especially when we're looking at 2030. No, we can't ignore the chronic health conditions of our elderly members, but we have to start with the kids. For that, the managed care organizations give incentives for the vaccines and wellness exams. We give gift cards for the kids. I'm so excited, so happy that the governor vetoed the bill and that West Virginia is one of the few states that mandates the kids have to be vaccinated to go to school. We have combined wellness exam with sports physicals, so mom doesn't have to take them to the doctor twice. They can be done the same day, encourages the kids to participate in sports. Aetna Better Health has a kids club for kids up to 13. We call it the Dr. Ted E. Bear Club. Quarterly, we offer the kids incentives to brush their teeth every day, get out and get physical activity in, things like that. And when they complete that activity, they get a little prize like a basketball or soccer ball or something like that. We scholarship our members' children to Camp No Coma, which is a camp for diabetic kids, Camp Catch Your Breath, a camp for asthmatic kids, so they can get out and get physical activity that is geared to their illness and make them feel like normal kids. We also give our members a $100 a year voucher for after-school activities that encourage, a lot of these programs will encourage physical activity in the kids. not part of Vet and Better Health, but WIC also encourages, WIC benefits extend to the farmers markets where mothers and children can get benefits at the farmers markets. The state has also included SNAP benefits to extend to farmers markets, and these are doubled if you have children or elderly in the family over 60. And the farmers markets, I learned this week, also will accept vouchers for anyone over 60. Anybody in the state over 60 can get an additional $50 to spend at the farmers market. For our members over 18, we incentivize them with a walking program. We send a pedometer to them. They finish the program. They get a financial incentive. We will incentivize all-terrain vehicle riding, which physical activity, maybe, maybe not, but they will get a gift card if they complete the training course. All of our members have access to the Active Health app, which has lots of health tips. They get rewards on that app as well. Lots of exercises, lots of health tips, cooking tips, etc. We incentivize our members that get a flu shot with a gift card to the state parks so they can get out and hike and enjoy the beauty of our state parks. All of our members that are age 30 to 45 that have a registered hemoglobin A1C over 9, which is a measure of, hemoglobin A1C is a measure of how well controlled your diabetes is, if anybody in here doesn't know that. If their diabetes is not well controlled, we will send them a packet of seeds. This program is called Growing Healthy Seed. We send them seeds to grow vegetables. Not only do they get some fresh vegetables, they get some exercise getting out in the garden. Through our partnership with Community Cares, which has clinics all over the state, we have helped facilitate health in our school-based clinics, in their school-based clinics. We are implementing currently telehealth in the schools so that, a kid with a sports injury, mom doesn't have to take the day off from work to come in and take the child out of school to get care. They can do telehealth. And we are always looking for new and innovative ways to reach out to our Medicaid population. We have some other things in the works. Stay tuned for that for further details. As far as, reword your second question for me.
Well, the second question I think you hit on. I was asking some of the examples of policies or programs that were being implemented that were encouraging individuals to lead healthier lifestyles. So I think you shared a number of those.
Okay. We should also be partnering with the Health Prevention and Chronic Disease to promote walking. The state of Montana has a Walk with Ease program. Now, this is for their commercially insured employees. The state of Montana, if a state employee finishes a 6-week walking program, they get a discount on their health insurance. I thought that was a great idea. Most of them, 6 months later, they followed up with them and they were still walking. At Better Health of Kentucky has partnered with their local YMCAs to give memberships. If we had more YMCAs in the state of West Virginia, I think the MCOs would do that. I don't know that we have the funding to do Planet Fitness and all the other HealthWorks and expensive gyms like that, but I think the MCOs could partner to do something like that.
Yeah, and that's that type of cross-sector collaboration is really what's highlighted in the plan, so that's appreciated.
Those are the things we need to be looking at.
Very good, thank you. Any other panel members want to weigh in on that?
I think the other issue that I didn't mention that I do believe is important to consider is that there is a finding by a Nobel Prize winner and his research partner wife in Princeton that basically identified in a cohort of Americans that people with degrees from higher education places, from universities, had an 8.5-year life expectancy improvement or increase from people that didn't. And I think that we don't want to misinterpret that and say, hey, if you didn't go to college, you're going to live shorter. I think what it says is that being ready and trained for the knowledge economy and finding a great job that you like, that gives you purpose, community, income, et cetera, is really important. So Sean, I would just throw out there that I think we can't forget about the role of education. Almost every country that is evolving really does focus on educating their population and to prepare a workforce for the future, because we're recruiting, Speaker Hanshaw and others are recruiting great companies to come into West Virginia, and now we need to match that, I think, with a trained workforce, and I believe that is also part of what could generate better health.
Very good, thank you. Joe, you've been off the hook so far, so we're gonna put you on the hot seat now. How do you think Game Changer, which is the program that you're involved with, can affect the overall health of youth and adults in West Virginia? And then I have a follow-up prompt that I'm going to ask for you as well, but go ahead with that first one.
Well, obviously we have a major problem, not just in West Virginia, but the entire country, with opioid and substance misuse, and of course deadly fentanyl, and now cofentanyl, which is an elephant tranquilizer that is now emerging and being used in counterfeit pills that kids can buy over the internet, that can result in the death of a child within 5 seconds after ingesting cofentanyl because of its power. We were fortunate, and we've been blessed at Game Changer to have a tremendous amount of support from all factions of the state and the nation, including the business world, the education world, the political world, and everyone from every walk of life understands that our kids, a generation of our children are at risk for early death because of this. And we were fortunate to develop a working relationship resulting in a contract with the Hazelton Betty Ford Foundation, which I think everyone knows is probably the preeminent prevention and treatment company in the entire world. And obviously, prevention is the key. The easy part is saying that if a child never tries a drug, the child will never become addicted. If anyone doesn't try a drug, they won't become addicted, and unfortunately, that's not the case. So through the course of the last 5 years, we've developed what we believe is the finest comprehensive prevention education plan in the entire country that we're now implementing in West Virginia schools and soon to be in Kentucky and Tennessee schools, in pilot schools. The whole idea behind it is to begin in that K through 5 age group and begin with programs that are age appropriate, that will educate and teach kids through health, through healthy bodies, healthy eating, the dangers of what fentanyl and drugs do to your body, both short-term and long-term. And it progresses up to grades 6 to 8, and then the final part of the program is, of course, 9 to 12. Unfortunately, you know, the United States in particular, we are a society of wanting everything in an instant. We want instant results. We want to make sure that whatever we do, we see a result tomorrow. And unfortunately, this is not going to be solved overnight because it wasn't created overnight. And so we believe our program is methodical and very educational, and it touches on all aspects of health, even to public speaking and peer leadership, to where the older kids in the program mentored the younger kids in the program. We just had a video that I think you'll have a QR code. It's a very quick 5-minute video that I encourage you to watch, because it will tell you exactly where Game Changer is today. And it touches on the fact that the biggest part of it is about the kids' involvement and how Game Changer has become cool. That's one of our first goals. If we can get in the school system and make it the thing to do, they're wearing our Game Changer t-shirts. It's becoming kind of the in thing. They're being educated about healthy aspects of living, and in doing so, being also educated on what that can be for you as opposed to unhealthy living. To try to address the societal instantaneous desires of getting results, we have produced 2 movies that one is for grades 6 to 12. It's called One Pill Can Kill, and it talks very heavily about the dangers of fentanyl and what fentanyl does. It talks to a person incarcerated in one of our prisons for 20 years for selling drugs, including to her own son, who OD'd in front of her. And it is age appropriate, so it is not for anybody below the 6th grade. We are now just finishing production that will be available in the fall called You Have What It Takes, and it's for 3rd to 5th graders. It's very age appropriate. We collaborated with the Nickelodeon kids and PBS kids and a committee from our Department of Education to make sure that what we were going to show these kids were indeed age appropriate. Both films come with a teacher lesson plan and a parent toolkit that we worked with our collaboration with the DEA, the United States Drug Enforcement Administration, and it gives teachers the opportunity and direction on how to use the film in segments to be able to further educate our kids. Both films will be in our schools this fall. Just last week at our event down at the Greenbrier, our fundraising event, Superintendent Michelle Blatt announced that as part of the fulfillment of Lakin's Law by the legislator, that our kids in middle to high schools will be required to have some sort of prevention education. They are going to use the One Pill Can Kill film along with the parent toolkit and the teacher lesson plan. We're hopes that then it is indeed sent back to parents, that we encourage parents then to sit with their children and watch the film and further discuss it. The same with 3rd to 5th grade. We are now beginning plans with the Nickelodeon kids, PBS kids, and Department of Education on the last segment of this phase is an age-appropriate K to 5. And or K to 2, I'm sorry, a K to 2 film that will then follow sequentially to 3 to 5, and then, of course, to the One Pill Can Kill. So we're hopeful that by doing this, while we're implementing our prevention education program in our schools throughout the state, we're trying to provide a well-rounded approach to make sure that we attack this with everything we have, because it is real and it's not going away anytime soon. And the only way to really defeat it is through the healthy aspect of it. And once kids begin in kindergarten, it's hoped that by the time they're in 8th or 9th grade, they, when having the opportunity to use, they won't, because it's in their minds that that's the wrong thing to do.
Okay, thank you. Looking at time here, I want to thank the panel, and I think this was a very good start. You know, from Dr. Marsh, we sort of heard the bigger picture idea of where we're headed with respect to physical activity and its important role in health and across the state. Dr. Hembry shared some wonderful examples of programs that are already on the ground relative to our healthcare system, and then the work that Joe's group is doing in the schools certainly gives us an effective model to look for. And one of the things that he mentioned that really resonates with those of us who've been involved with the plan is, you know, what is it that we can do to make physical activity cool? And that's in the easy choice for West Virginia. And so those are ideas that we'll certainly hear more about across the morning and afternoon. So that brings our first session to, well, not to a close, I suppose. The next stage of the process here is you'll have the opportunity for your roundtable discussion. So we task you with, reflecting on and sharing your own ideas relative to the comments that we've just heard. Our panel members will be circulating around to provide additional input, engage in your conversations as needed. So let's hear a round of applause for our panelists.